are the approaches of qualitative and quantitative research? Based on approach. Quantitative research. It is an inquiry into an identified problem based on testing theory composed of variables measured with numbers and analyzed using statistical techniques. In this type of research, data is collected in numerical form and analyzed by using descriptive and inferential statistics. Quantitative research involves analysis of numerical data. Qualitative research is often an iterative process whereby evidence is evaluated, theories and hypotheses are tested, and technical advances are made. The three major types of quantitative research designs are experimental, quasi-experimental, non-experimental research designs. In biomedical and epidemiological research, the experimental for true experimental research is commonly termed as randomized controlled trials for randomized clinical trials. Non-experimental research is further classified into descriptive, exploratory or correlational research. The non-experimental research is commonly known as observation studies in the biomedical and epidemiological literature. Example of quantitative research. Descriptive study on the prevalence of healthcare-associated infections on patients admitted in intensive care units. In this research study, the researcher deals with numerical data. Qualitative research. Qualitative research is a field of inquiry that crosses disciplines and subject matter. It involves an in-depth understanding of human behavior and the reasons that govern human behavior. Your data is collected in descriptive form rather than numerical form and analyzed by descriptive coding, indexing, and narrations. Qualitative research involves analysis of data such as words, pictures, objects. Qualitative research is the examination, analysis, and interpretation of observations for the purpose of discovering underlying meanings and patterns of relationships, including classification of types of phenomenon and entities in a manner that does not involve mathematical models. Qualitative research has the following main features. Qualitative research is concerned with the options, experiences, and feelings of individual producing subjective data. Qualitative research describes social phenomena as they occur naturally. Understanding of a situation is gained gradually through a holistic perspective. Qualitative data are collected through direct interaction with individuals through one-to-one or group interviews or by observation. Data collection is time-consuming. The intensive and time-consuming nature of data collection necessitates the use of small samples. Criteria used to assess reliability and validity differs from those used in quantitative research. The five major types of qualitative research designs are phenomenology, ethnography, grounded theory, case study, historical research. Example of qualitative research. A researcher is conducting a study on experiences of women who have underwent female feticide in selected rural and urban areas in Punjab. In this instance, researcher is not handling any numerical data and there is collecting descriptive narrations were organized by the subjects. Steps of quantitative research process. 1. Formulation of research problem. 2. Determining study answer. 3. Review of literature. 4. Developing conceptual framework. 5. Formulating hypothesis assumptions. 6. Selecting the research approach design. 7. Specifying the population. 8. Developing tools for data collection. 9. Establishing ethical considerations. 10. Conducting pilot study try out of tool. 11. Sample selection. 12. Data collection. 13. Preparing data for analysis. 14. Analysis and interpretation of data. 15. Disseminating the research findings. Quantitative research is a formal, objective, and systematic process for gathering information about the world. Quantitative research is conducted to describe new situations, events, or concepts. In quantitative research, study variables are pre-selected and defined by the investigator. The data is collected and quantified. That is translated into numbers, and then statistical analysis, often with the view to establish cause and effect relationship among the variables. This process is an orderly way of dealing with the research problem where variables are generally studied in numerical or quantitative form. The research process starts with identification and formulation of research problems and ends with the dissemination of research findings. Formulation of research problem. The formal step of the research process is to discover an interesting and research work the problem. It is such an important step that the whole process can get wasted if the research problem is not clearly understood or defined. Therefore, very good research needs a good research problem. It generally starts with a broad topic and later it is narrowed down to a specific topic of the study. For instance, a researcher wants to conduct a study on morning sickness symptoms of antenatal mother. This is the broad topic. Later it is disseminated to a specific topic, that is effects of gender on morning sickness symptoms during first trimester among antenatal mothers. The PICOT model also serves as a guide for formulating a clinical research question research problem. P. Population. Patient. What patient population are you interested in? I. Intervention. What is your invested intervention? C. Comparison group. Comparator intervention. What is the alternative to compare with intervention? O. Outcome of interest. What do you intend to accomplish, measure, improve, or effect? T. Time. What is the appropriate follow-up time to assess outcome? To formulate an interesting, creative, noteworthy, and indicated process problem, the researcher must gain show features of originality, solvability, feasibility of research problem, as well as the need to take into account the following dimensions. Substantive dimension. Methodological dimension. Practical dimension. Ethical dimension. PG 46. Steps of qualitative research process. 1. Identifying the research problem area. 2. Formulating broad study objectives. 3. Review of literature. 4. Entry in the research setting. 5. Selecting research approach design. 6. Select a small sample. 7. Establishing ethical considerations. 8. Planning tools for data collection. 9. Collecting data. 10. Organizing data for analysis. 11. Analysis and interpretation of data. 12. Disseminating the research findings.